Health Cloud, a cloud to inspire your health.
In this video, we are not going to talk in a traditional way about signs and symptoms of COVID-19, since we all have got familiar with them. But we gonna talk about more important issue that could be fatal if not being aware of, which is what is the difference between symptomatic and asymptomatic COVID-19 patients. Some people who get infected with COVID-19 are asymptomatic, meaning that they didn't feel any symptoms of the disease but still infected with positive PCR test result. In a new study published in Nature Medicine, researchers compared what happens in the bodies of people with both symptomatic and asymptomatic infections. And it turns out that not having symptoms of COVID-19 doesn't mean your body is not infected. The most important questions of asymptomatic COVID-19 patients are they contagious? How common they are? And how much the real number is?
Some studies have estimated it might be around 35 to 40% of cases. So we really want to know, what if anything happens to people in these situations? In the new study, researchers in China looked at 37 people who tested positive COVID-19 and had mild symptoms, as well as another 37 who tested positive but didn't have symptoms. And even if it wasn't obvious from the outside that the asymptomatic patients were sick, for most of them you could easily tell by looking at their lungs. Of the 37 patients in that group, 21 of them with ground glass texture that is characteristics of COVID-19 even though they felt fine. The team also confirmed that people who are asymptomatic can still be shedding virus particles all over the place. In fact, they tended to do it for longer than people did have symptoms. That's troubling, according to the recent studies and experiments of asymptomatic COVID-19. They are contagious, and for longer time.
Whether symptomatic or asymptomatic, currently, the main transmission routes of the novel coronavirus are through respiratory droplets in close contact with existing patients. Now, you may ask, since there is no symptoms, how do I know if I am an asymptomatic carrier of COVID-19? The short answer will be, PCR is the main way to identify asymptomatic patients of COVID-19. You don't have to worry too much. All what you have to do is to report and self-quarantine for 14 days even if you don't have any symptom. Be aware, the close contact with asymptomatic patients also need a 14 days of isolation. Some experts believe that due to absence of symptoms, such as coughing and sneezing, the chance of transmission from asymptomatic patient is relatively less than from confirmed COVID-19 patients with symptoms. But be aware, that doesn't mean you should guard down, because breathing and speaking can also expel virus. Just like any respiratory diseases, you can protect yourself and others by wearing mask, washing your hands frequently, avoid touching your face and keep a 6 feet distance from others. As well as exercise also improve your immunity. Only a few asymptomatic patients develop into confirmed cases, the majority will self-heal. With proper protection, the likelihood of being infected is very low. At the end, a great tribute to the healthcare warriors and the frontliners. Staying safe, making them breathe. Stay protected. Thank you.
Health Cloud. A cloud to inspire your health.